Ready
Yeah,
to take it? Ready
yeah,
to
I'm
take
here.
it away? Okay. And Louise has the controls, Shanaz, to advance the slides. Okay. So you'll just have to tell her.
Okay, sure, I'll do that. Hello and welcome everyone to our presentation on integration of quality improvement, QI processes and strategies with the Baby Friendly Initiative, or looking at BFI through the QI lens. As Margaret mentioned, through a 2-day workshop in Winnipeg in March this year, organized by BCC, we engaged into the whole process of integrating or understanding the integration of QI into the BFI implementation through the tools and guidelines that have already been created by BCC. So through this presentation, I aim to put forth the gist of that learning and discussion at the workshop. And those health, there have been some health care facilities with us throughout this whole process of coach mentor program that was initiated by the BCC. So they have already had that exposure of working through this whole process and had the opportunity to experience it. Next slide, please. So the primary goal of QI, or quality improvement in healthcare, is to improve clinical practice and health outcomes. According to the Quality Improvement Guide by Health Quality Ontario, an excellent resource, if you would like to check it out. Quality improvement, or QI, is a proven methodology aiming at enhancing care for patients and clients. And QI process involves a team that works towards a specific aim by gathering and reviewing relevant data and putting in place frequent measures and implementing change strategies through rapid cycle improvements. Next slide, please. So when referring to BFI, those of us who have been involved with a Baby Friendly Initiative, we know that BFI aims to increase breastfeeding rates and improve maternal and child health outcomes. The BFI journey benefits from quality improvement strategies embedded in its implementation processes because it provides a structured approach for both BFI implementation and evaluation. And by integrating BFI practices in this way, they become ingrained in the QI culture and the values of a healthcare organization. Often BFI practices or baby-friendly initiative practices are already woven into the quality improvement indicators at healthcare facilities, like initiating skin-to-skin contact or encouraging rooming in, and so on and so forth. And even if they are not explicitly recognized as part of BFI practices, they are still being practiced, and because they do provide a measure of improving health outcomes. Next slide, please. So as we look at the BFI 10 steps, these BFI 10 steps, they provide us with QI indicators that measure changes and improvements in clinical practice and health outcomes. And examples of these indicators would include percentage of health professionals competent in assisting mothers to latch their babies, rate of skin-to-skin contact after elective cesarean births, or exclusive breastfeeding rates at discharge from hospitals or birthing centers. So these are some of the examples that the whole 10 steps, it's part of the 10 steps of the Baby Friendly Initiative, and that sets the background for providing the quality improvement indicators. And another example would be exclusive breastfeeding rates at 2 months of age assessed during vaccination appointments in primary care settings. So at different points in time, the indicators could be measured through the BFI 10 steps. And then we can understand and evaluate how the program has been running, how effective it has been, through the measures and strategies and tools given by the QI methodologies. Next slide, please. So the quality improvement offers, as I mentioned, quality improvement process offers tools and methodologies and processes that are essential for initiating, accelerating, and implementing improvements in BFI practices. And by incorporating the QI science into the BFI journey, we can utilize strategies like PDSA, plan, do, study, act cycles, to plan for improvement. This systemic approach ensures that our initiatives are based on testing and learning and making the improvement process more effective and sustainable. Lastly, I would like to say that it's really fascinating to see how QI strategies are woven into the implementation of BFI practices to improve health outcomes and encourage ongoing enhancement. With that, I hope you've gotten an idea of how the integration happens. Of course, it's very, very detailed, and we would love the opportunity to discuss further with whoever is interested in taking it any further. With that, I will hand it back to you, Margaret. Thank you.
Okay. So Louise. Yeah.
Yep. Okay. So as you may know, I'm Louise Guthrow, and had the opportunity to join this workshop in Winnipeg. And it was a very exciting day in March when approximately 55 BFI organizational leads from all across Canada gathered in Winnipeg to learn about quality improvement and how it could help them with their BFI journey. There were people from both hospitals and community health services representing each province and territory. To see and feel the energy in the room was invigorating. For so many of us, it was the first time attending an in-person workshop since COVID, and for some, their first time at a BFI event. Leading the two-day workshop was Michelle Ledrew from Nova Scotia and Kathy O'Grady-Venter from Ontario. Michelle and Kathy are co-directors of the BCC BFI Quality Improvement Project, funded by the Public Health Agency of Canada. And what a group it was. We were so proud to have 6 participants from Ontario, plus 3 QI presenters, Margaret, our chair, and Shanaz, who you just heard speak earlier, were coach mentors with the BCC BFI QI project, and Kathy O'Grady-Venter. Each participant was given a BFI QI workbook to assist them with using the BCC's quality improvement tools and resources to plan, implement, and evaluate steps on their BFI journey. All of the tools and surveys were developed using the QI project over the past 5 years. We as a team thought it would be good to share stories from each of the participants that attended. Unfortunately, not everyone was able to join us today, so I will fill in for those who were not able to attend. It was so great to meet a fellow cross-stitcher, Laura Patterson. You can see here the intricate breast that she was working on for many years. It was pretty impressive. Laura works as a lactation consultant at the Black Creek Community Health Center in Toronto and is also president of the Canadian Lactation Consultants Association, known as CLACA. Laura loved meeting colleagues from across Canada and enjoyed sitting with others that worked in the community and learning how each community worked with their clients, parents, partners, and colleagues to provide breastfeeding support. Laura's aha moment was that all the forms and how helpful they will be. She looks forward to surveying clients on what works, doesn't work, or what they want for support. Being able to leverage the work of others to support the overall goal of more babies being breastfed. So Nancy wasn't able to be here, but she created a little video sharing her story.
Hi everyone, I'm Nancy from Guelph General Hospital, and I want to share with you my aha moment that happened during the QI workshop for BFI. I am new to the role of lactation consultant, and actually thinking of tackling BFI sounded so huge for me before I went to this QI workshop. And what happened to me and how I had my aha moment was just listening to everybody in the room and engaging with the tools that have already been invented. I realized I do not need to reinvent the wheel. There are tools out there that are very straightforward, and they can help design your BFI journey or my BFI journey into some nice, neat, bite-sized little chunks, and that I don't have to be solely responsible for everything. So then, using the tools in my little workspace here, I have my live Excel spreadsheet that's on the go, and if I find I have a few spare minutes, then I can always just like pop over to it and see like, oh, kind of what's on this task list and what can I tackle that is going to be a nice bite-sized piece for a few moments. And that, whatever process works for me. So if you're just a sticky note person, then you can engage that process into your plan. And, this is how I built my team, because I just kept gathering different people that wanted to be part of the team. Yeah, and so then I just filling my space with the tools that are available, and knowing that I'm not here by myself. I can engage with the tools that have already been created. So that was a great aha moment for me. Thanks for engaging with us. Hi everyone.
So Andrea, she's with us.
Hi there. Yep, I'm here. My name's Andrea. I'm from Guelph General Hospital. I'm currently the interim clinical educator, and I've started taking my lactation consultant courses as well. And I was fortunate enough to join the team at the conference in Winnipeg and learned a lot that I'd love to share with you. So it was nice to sit amongst like-minded individuals, and being earlier in my career, I got to connect with a lot of people who have much more experience than me and had lots of stories and ideas and experiences to share, which was great. So I really enjoyed the workshop, not only for all of the things that I learned, but the people that I got to connect with. So the biggest takeaway, I think, for me was I really enjoyed the PDSA presentation that Margaret did. It wasn't a concept that I was super familiar with before, and if I'm not going to go into depth, but if you haven't heard of it or you haven't used it before, I would recommend looking into the process. But essentially, the plan, do, study, act concept is a way to assess it, assess changes that you've made. So it's grounded in the idea that quality improvement and change is an ongoing process, and the way that Margaret presented it made it very simple. And you can start with a very small sample size and start to build and engage more stakeholders as you go. But there's an ongoing process and a cycle. And so that's something that I would love to kind of move forward with and use in my role in my program. So that was the biggest takeaway for me.
Okay, thanks so much, Andrea. So on behalf of Angie Manners and myself, Angie, who is from New Liskeard in Northern Ontario, Angie is a BFI Ontario executive member and also a BCC BFI assessor. She works in a community health center and is going back to school in the fall for a nurse practitioner. Myself, as I mentioned, my background is that I worked for 40 years as a nurse and a lactation consultant in a BFI hospital, and also worked with the BFI strategy until 2019. It was exciting to be connecting with like-minded people from all across Canada. It was so exciting and inspiring. Learning what other provinces are doing for BFI implementation and sustainability was one of the best takeaways. We were both excited to see the toolkit and all the forms and surveys. They demonstrated how user-friendly the forms are to duplicate, adapt, and to adapt and to extract and analyze the data. Angie is excited to bring these tools back to the hospital and community partners in her area in hopes of them using them. I myself was excited being on the executive to be able to share them with the membership and hopefully gain some interest in using them. So I'm just going to give you a little bit of an example of some of the tools that were shared in the toolkit. As you can see, there's great potential for all organizations. You can see that there's different tools for both hospitals and community. The parent survey working group helped to develop the survey for the parent, my tongue's getting all mixed up here, sorry. The patient survey working group who developed the survey included parent partners. These BCC tools are meant to assist facilities to monitor, track, and analyze care practices to inform BFI quality improvement practices. These forms were developed using Microsoft Forms, and duplication of the form enables you to create your own copy. All the information collected and contained within the forms can be maintained within your own facility's agreement with the Microsoft Office. The surveys that excited me the most was the patient survey and also the staff survey, both helping you understand what you are doing well and where there are gaps. Each of the surveys comes with a user-friendly manual, step-by-step, how to use, adapt the form, and make it your own. Once you get to know the forms, you can create your own survey and test your PDSA cycles. So you can see there's the patient survey, and then they have the user manual. There's the a chart audit, which is in 2 different formats. So there's a chart audit survey to help if you're going through your charts, to ask what questions are relevant. And then there's also an Excel sheet for you to put the data in to keep track of it. And again, a user manual for both of those. And then there's the BFI staff survey for both hospitals and community health services. And again, a user manual for them. If you want to see a bit of an example of the hospital patient survey, you could scan the QR code with your phone. We shortened the survey. If you were to do it, it's only going to ask you about 5 or 6 questions. If I were live with this survey, as soon as you finished, I would be able to go back and look at the results. These are quick ways to get feedback. Unfortunately, I don't have that, so I'm not going to do that with you today, but it was pretty exciting to see. When you look at the back end of these forms, you are able to share the survey either by email, create a QR code, include it on a poster, a discharge pamphlet. Use of the surveys, you can also use it during a presentation, and responses are available. As you can see over here, this is again looking at sort of the insights. It's available in graphs, or you can also open them up with Excel. To get access to these forms and toolkits and the toolkit, you become a member of the Breastfeeding Committee of Canada and request a QI toolkit. The cost of membership is $35 to the BCC. This slide here is just, we said, you know, if you wanted to learn more about QI, this is a great resource video on QI developed by St. Michael's Hospital in Toronto. So we would encourage, and I'll put on this link into the chat in a little bit so that you can have access to it later, and we'll share it perhaps in the minutes as well. It's a really great video. And, you know, we're wanting to start a BFI QI movement in Ontario, and it only starts, you know, a movement starts with one person, and then we need to get other people to follow. Be courageous, show others how to follow. Come follow the BFI QI movement. So we're looking for questions. And also this is just kind of a sharing time. Do you have any BFI QI projects that your organization has undertaken? Or how can BFI Ontario help enable and support QI in the province? So I'm gonna stop sharing. No, yes, I'm gonna stop the recording.